Hello, everyone. This is Group 3 presentation on the topic of depression for HCA 465, Section 5, presented by Hui.
I'm Han.
And I'm Angie.
As for the table of contents of our presentation today, we will be discussing the literature review, data and methods, results, and discussion. Next, Angie will be introducing us to the background context of depression.
Thank you, V. Briefly, we know that depression is heavily prominent and common in today's society that severely affects how one feels, thinks, and behaves. We also know that this can manifest physically. Moving forward, depression can be caused by various factors such as hereditary, brain chemistry imbalance, medication use, environmental stressors, as well as medical issues. Because this detrimental condition can interfere with one's life, the symptoms include sleep disturbances, including insomnia or sleeping too much, lethargy, reduced appetite, and weight loss, as well as feelings of worthlessness, and lastly, lack of motivation and pleasure in day-to-day activities. To begin, the literature review will be discussed by Hui.
Thank you, Angie. To begin, a literature review of our presentation was conducted to gain a better understanding of depression. For gender and employment status, a study has found that depressive symptoms were more prevalent among men who were unemployed while compared to men who acquired a profession. However, there were no findings on a correlation between depressive symptoms and employment status in women. For income level, there is a well-established correlation between mental health and income levels. Specifically, a study that was conducted revealed that as the share of a family income increases over time between partners, men's depressive symptoms decrease, while women's depressive symptoms increase tremendously. Interestingly enough, both higher income and lower income groups saw a correlation of an increased level of depression. Ultimately, other studies have reported that depressive symptoms vary between different education levels and age groups as well. Some studies have found that in most age groups, young high school students have a marginally greater rate of depression than most college students. This could be prevalent in countries such as South Korea due to their high standards and expectations that are set upon high school students, including extreme academic pressure or social exclusion. Next, Angie will now discuss the data and methods section.
Before I delve into the specifics of the study, I would like to inform you that the aim of the study is to examine the prominence of depression at the specified state level. With that being said, the findings are critical in terms of finding and collecting data and information regarding depression. As for the participants, Centers for Disease Control and Prevention, also known as the CDC, has partnered up with the Center for Mental Health Services, Substance Abuse, and Mental Health Services Administration to conduct a behavioral risk factor surveillance system survey. To thoroughly carry out the study, the organizations used an 8-item patient health questionnaire depression measure, also known as PHQ-8, as the foundation to obtain information about depression. To specify, there were approximately 217,000 participants who answered questions from the interviews. However, 0.8% of the participants did not answer questions regarding lifetime diagnosis of depression. In addition to that, 8.6% of the PHQ-8 scores went missing. The organizations also discovered that individuals aged 18 to 24 were more likely to be depressed than those aged 55 and above. Moreover, participants without a proper high school education were found to be depressed than those who have achieved high school education. In terms of gender, men were found to be less likely to experience depressive symptoms than women. Lastly, Black non-Hispanic has a higher percentage than any other race or ethnicity at 11.0%, followed by other non-Hispanic at 10.4%, Hispanic at 9.9%, and lastly, white non-Hispanic at 8.0%. Moving forward, the data information from the BRFSS study was specifically collected through telephone interviews on a monthly basis. As previously stated, the PHQ-8 was used as a foundation to identify and evaluate the prevalence of depression and its adverse effects in the United States population. The PHQ-8 only contained 8 out of 9 questions from the DSM-4 diagnosis of depressive disorders because one of them actually addressed suicidal or self-injurious ideation. Therefore, it was removed because the interviewers concluded that this question had a minimal impact on the scoring, as the thoughts of self-harm were fairly uncommon in the United States population. Additionally, for the sake of validity and consistency, the PHQ-8 was systemized to be equivalent to the other BRFSS questions in which the respondents were specifically asked about their smoking habits, physical activity, level of consumption, and whether or not they had a depressive disorder. Now, Hui will be discussing the results section.
Thank you, Angie. Before getting to the results of each variable, we would like to specify the type of test used in our study, as well as determining our hypotheses. The chi-square tests were utilized to identify if a relationship exists between the variables. In this case, the dependent variable is characterized as depression, whereas the independent variables are age group, gender, race, ethnicity, education level, income level, and employment status. For the null hypotheses, both categorical variables of depression and demographic factors are independent in that they do not have a relationship with each other. In contrast, the alternative hypothesis is that both categorical variables of depression and demographic factors are dependent, in which they have a relationship with each other. Next, I am going to pass this to Hung for her to discuss about the age group results.
Thank you. When talking about depression, we have to consider the most basic factor, and that is age. According to our SPSS study, 22.6 of those between the ages of 45 to 64 reported suffering from symptoms of depression, 21.3% between 18 and 44, and 16% for those who are 65 years of age or older. As you observe, the chi-square statistic value for this group is 2,363.59 and the p-value of 0.000, or in other words, less than 0.001. Since that number remains less than a significance level of 0.05, we can reject the null hypothesis as there is a statistically significant relationship between the age groups and depression. And now we will talk about gender. When it comes to depression, another subcategory to consider is gender. 24% of females reported struggling with depression and 14.7% of males reported. The SPSS data yields the chi-square statistic value of 6,008.84, and the p-value remains at 0.000 or less than 0.001. And that is less than 0.05 as we know as our significance level. Therefore, again, we can reject the null hypothesis as there is a statistically significant relationship between gender and depression. Now, Angie will take over the race and ethnicity section.
Thank you, Han. As for the race ethnicity category, 23.4% of non-Hispanic other participants suffer from depression compared to others, which includes non-Hispanic, American Indian, or Alaskan Native at 22.9%, non-Hispanic at 20.7%, Hispanic at 17.6%, non-Hispanic Black or African American at 16.3%, and non-Hispanic Asian or Pacific Islander at 8.4%. As the chi-square statistic value equates to 1,509.36 and the p-value is 0.000, we would reject the null hypothesis at the significance level of 0.05. This further indicates that there is a statistically significant relationship between the variables of race or ethnicity as well as depressive symptoms. Pertaining to the education level, those who attended some high school or less takes the lead for having the highest rate of depression at 25.0%, followed by those who are in some college at 22.4%, high school graduates or who have achieved a GED at 20.4%, and finally college graduates or more at 16.8%. The chi-square test illustrates that the chi-square statistic value of education level is 2024.55. The p-value is 0.000. Therefore, we can conclude that there is a statistically significant relationship between education levels and depression at the significance level of 0.05. Now, Hui will be talking about income level and employment status.
Thank you, Angie. Moving on to income level, about 36.2% of individuals that make less than $15,000 annually experience more depressive symptoms out of the entire division. To expand, about 24.4% of the individuals who have an income level between $15,000 to $35,000 takes the second place, followed by those with an income level between $35,000 and $50,000 at 19.4%, those with an income level of $50,000 to $75,000 at 17.9%, and lastly, those with an income level of $75,000 or more at 14%. The chi-square test shows that the chi-square statistic value of income level is 10,110.89, and the p-value is 0.000, which is less than the significance level of 0.05. This specifies a statistically significant relationship between the variables of income level and depression, and we can reject the null hypothesis. Last of all, for employment status, 53.5% of individuals unable to work struggle with depression, followed by those out of work at 31.1%, homemaker at 20.8%, students at 20.2%, retired at 16.4%, and ultimately those employed at 16.1%. It is portrayed in the chi-square test that the p-value is 0.000, which is less than the significance level of 0.05. In addition to that, the chi-square statistic value is 27,519.48 for employment status. Therefore, we can reject the null hypothesis since there is a statistically significant difference between depression and employment statuses. Next, I will be passing to Hung for her to discuss about the discussion part.
Thank you, Hui. All the categorical variables mentioned throughout the presentation is found to have a statistically significant relationship with depression in accordance with the findings. The p-value that we came to consensus with while creating the SPSS data is 0.000, and that is less than 0.05, which is our significance level. So our solution is to reject the null hypothesis. We understand that anything above the significance level of 0.05 equates to having no relationship. In that case, we would conclude that we fail to reject the null hypothesis. The limitations mentioned in the BRFSS study include those that belong to the lower socioeconomic groups, those that are institutionalized or hospitalized, because it is possible that they are not physically or mentally capable of doing the study to its fullest extent. Lastly, those who have limited phone access or block unknown or strange incoming calls. After considering all the methods and data acquired from both the BRFSS study and our SPSS tables, there are a few things that we thought could make the study and the treatments of depression well-rounded. One of them would be considered conducting additional studies to further examine the micro effects of the categorical variables have on a person coping with depression due to these reasons. We are aware that just because there's a correlation does not mean there is causation. Once the additional studies are conducted and more data are retrieved, researchers along with psychiatric professionals are equipped enough to formulate more personalized treatments in order to create a safer and more responsive environment for each unique situation. We would hope that studies like this continue as more symptoms can possibly surface in the future as our world evolves. And by keeping up with the trends and acquiring new data for the archives, medical professionals can continuously update the treatments in order to yield a higher success rate for patients suffering with depression. And this concludes our presentation. We thank you for your time, and we hope that this research project has given you the additional knowledge about depression.